An implantable cardiac defibrillator, or an ICD, is a small device similar to an artificial pacemaker that's implanted into your chest and connected to your heart. So where this differs from a pacemaker is it will monitor and correct your heartbeat or your heart rhythm. So it can either stop an arrhythmia by automatically pacing your heart, similar to the artificial pacemaker, or in more serious situations, it can give your heart a controlled electrical shock or a series of shocks to return it to its normal heart rhythm. So normally we'll see this in someone's note. They may have had a pacemaker to begin with and then they were upgraded to an ICD. So you may have more of these abnormal heart rhythms that are coming in and they just want to pop the ICD in just in case it becomes more serious. It can go off and reset your normal heart rhythm again. It can also support your heartbeat, similar to a pacemaker if it's beating too slowly. It can also collect and store information about your heart's electrical activity so that your doctor can review this and look into it when you go in for your checkups. People who are at risk of ventricular tachycardia or ventricular fibrillation, so these are those really serious abnormal heart rhythms, may benefit from having an ICD. So even if you haven't had any before, if you're at higher risk, such as people with heart failure, if you've got really enlarged ventricles and there's a lot of spacing in between, you're more at risk of having these abnormal ventricular tachycardias compared to if your heart muscles are normal size. So in these situations, they use it more as prophylactic or preventative measures by having an ICD as a safeguard in place.